I did emergency medicine for 15 years and then went into private practice in rural Greenhill, Alabama. We get everything here. I mean, I've had everything from a guy run over by a tractor. I've sewed on 3 fingers that got cut off with a saw. So it's a unique environment. We call it Greenhill ER.
We have 3 providers, 1 physician and 2 nurse practitioners.
We have a big patient load. Usually during the winter months, I mean, he can see 80 patients a day.
Scheduling is challenging because when we have patients that walk up to the front window and they need to come in right then and the doctor doesn't have an opening, so you're trying to squeeze them in without upsetting the other patients that are out in the lobby already.
10 people a weekend stop by my house to see if I can keep them from going to the hospital. So I mean, I don't think that happens normally in family practice.
My doctor's different. He's from the ER, so he can do anything with anybody. He saves a lot of patients money from going to the ER, so I have to look up a lot of codes, and he does a lot of specialty billing.
I've come down here at 11 o'clock at night and put stitches in someone. I mean, and that's what you do when they're your neighbors and friends. Front office people may spend 2 to 4 hours a day looking for the chart that I had misplaced.
Looking for charts everywhere, running around. Have you seen Mr. So-and-so's chart? And trying to find, did this patient's labs come in yet?
Being rural, I mean, we have a fairly large amount of people who don't have computers. And I know that's foreign to most people in the U.S., but DSL does not come here. Before the EMR, vacation was scary. Now, I mean, this winter when I went to Colorado snow skiing, you know, if they had an x-ray to send me, I mean, they sent within 30 minutes for me to see it online through our EMR.
It's wonderful if you get called from the answering service and you can just go straight into their chart and find out what you need to know, what medications they're on or what the physician has done that day or lab work that's been elevated. It's really easy to just open up your laptop and find the information there.
You can do your billing anywhere you want to, so the doctor's, you know, financial stability never gets affected.
We kind of transition slowly, and so we're clicking at about 110% as far as our productivity.
Denied claims, my percentage is below, like, usually 1%.
Associating the labs with the charts, you know, that's been a big plus for us.
Instead of it going and flipping through pages and pages, it's right there. And if you walk in, Misty carrying a laptop, me carrying a laptop, just some of the older people, they kind of look at that, you know, and they kind of wonder, is he surfing the web, you know, while he's, and sometimes they do.
We're actually seeing more patients now that we're gone to electronic medical records because it's awesome to be able to go right to the chart and find it all there.
What's our limit? Whatever I feel like my britches are big enough to handle. I mean, so I know you can work on it wherever. I mean, if you're on a ski lift in Colorado, you can pull it up. It's kind of cut the chain from the ball and chain.